Positive Pulse. Take care of your mind. In this episode, we talk about access to mental health care. Enjoy!
So each episode a week, we kind of talk about a different aspect of mental health, wellness, or something that can influence it. So for this episode, I kind of wanted to talk about access to care. We could kind of take it a few different ways, but the main things with access to care are just accessibility, affordability of it, and just barriers that there are to care. So I kind of wanted to ask, because when I was asking other people about this, everybody kind of had different ideas. So when you hear access to mental health care, what's something that comes to mind just right off the bat when you hear someone say that?
I personally think of insurance issues, people who are uninsured or people who have insurance that just isn't really covered in a lot of different healthcare facilities and stuff like that. So the disparities involved in that.
I definitely think of the affordability issues, but I also think about children who may be in environments where their parents don't support mental health, so they can't access a therapist or psychiatrist.
No, yeah. So I actually just came from mental health clinical, but we found out through a patient that without insurance covering or anything like that, it's $2,000 a day to be at this one mental health hospital. And just it's crazy to me because that person, their whole thing was they were financially unstable, and that was making them very, very stressed out and very anxious. That was a trigger of anxiety for them. So I thought it was just so ironic that it's so much a day for these people to seek help, in which it's also putting them into a stressor.
Oh, sorry. I think going off of that, my initial thought was finances, but something that I personally run into has been availability. I think when I was trying to find a therapist, I would call around and call a few different places, and they would not have availability for months on end. And I think that can be really discouraging.
No, yeah, for sure. And kind of all of what you guys were saying was kind of what led me to pick this topic. Because in my own experience, and then being in a mental health clinical for nursing school, the biggest things I heard people say was I didn't know how hard it was going to be. Because I think it's really easy to be oh, I'm sorry you're going through this. There's help, there's resources. But then there is this barrier of you call around and they have availability, but it's hundreds of dollars a week and they don't take insurance. Or you call around and they have availability, but you have to wait 4 months, or there's just all these barriers. So after people take that first step, I think it sometimes isn't talked about how hard it can be to get in with someone. And then also, I kind of wanted to hear what you guys thought about, I don't know if nuance is the right word, but I think where it gets harder with mental health care is you want to kind of bond with the person. So I know in my life, I went to therapists and they've been, cheap, or if they've taken my insurance, but I haven't really felt great. It was kind of uncomfortable and awkward, and it's kind of hard to talk about your, fears or anxieties or whatever with someone random. So just kind of, if you guys had any thoughts or stories about, trying to find care and then trying to find care that you can afford, but also where you feel safe and comfortable.
I think what you said about bonding with a therapist is really important, because if you don't have that trust with someone, you're not going to disclose some of those most personal topics that you really need to talk about to address the issues that might be happening. And those issues with therapists being booked for months out, so you can't get into someone when you might be in a crisis and meet them, is a big issue.
No, yeah, for sure. I think it's also there's a lot of discussion about, resources, but it's just different than physical healthcare. For instance, I could go on to a My Health app right now, and if I wanted to schedule an appointment with a primary care doctor, like, oh, I could go like Friday and see someone like random and, you know, get an annual physical or get a flu shot. But if I wanted to like schedule an appointment, you know, to get a checkup for anxiety, it'd be like months out. Kind of talking about the financial, since like in the research I did, that was the biggest. I found that it says about half of providers are in private practice, meaning they don't take insurance, and a lot of them will say they can like super bill. However, I know in my experience, the super bill doesn't do anything. It always just gets pushed back to me. I was kind of just wanted to open it up to like thoughts on ways to kind of improve the affordability barriers, since there is such a wide gap between people who take insurance and people who don't take insurance.
I know something that is sometimes seen is like sliding scale. Like I personally don't have health insurance, and so that's like been a big issue for a lot of things, even though I know like a lot of therapists don't even take insurance. But I do appreciate the therapists that do like sliding scale based on if you're like a student or if you're like paying for your own therapy and stuff like that, and just like leaving it more as a conversation instead of like having a flat rate.
Yeah, sliding. I'm glad you brought up sliding scales, because that's a, you know, big thing that I know a lot of places are trying to do and open up like more slots, because not all therapists offer sliding scales, and then it kind of varies from place to place, like how much they're willing to work with patients. Some places do a sliding scale of like $10 off, which doesn't really help someone, and some will actually do like very good sliding scales. Let's see what else. Described as like the 3 A's to accessibility. So is it accessible? Like, can they get to the therapist? Like, do they have to drive there? Can they get there? The affordability. And then also just like, is it achievable? Because I know how Paige was saying of kind of like this cycle of, you know, you get care and then it's costing you a lot, so you can't do it in the long term. So I wanted to know if you guys had any thoughts about making like mental health care more like achievable for patients, where it's something that they can use and sustain in the long run, not like, you know, drop a bunch of money in the short term but can't receive that care long term.
I think that one of the only good things that came out of the COVID pandemic was the expansion of telehealth. So people that are in more rural areas that might have to before have driven 45 minutes to an hour for therapy every week are able to do it from their own homes. That being said, there is the issue of availability of affording internet services and therapy at the same time. But a lot more people were able to access these resources because they were moved online, so they don't have to make it to the office on time every time they go. So I think that's been something that's been helpful. And I know it's been helpful for me as well to be able to access therapy resources through a call or a telehealth session.
I definitely agree with that. Like, the telehealth has definitely made it a little bit easier to access. For me personally, I have been trying to look for therapists back home, and I live in a relatively small town, so it's really, really hard to find any therapists that take my insurance because there's just not a lot of options. So I've been looking more into the telehealth and therapy online and stuff like that, and it's good to have a backbone like that to kind of fall onto instead of just, okay, where's a physical place I can go to get this help that I need? So telehealth is definitely something that is pushing us a little bit further into helping others with their mental health.
Yeah, I know when I was kind of thinking about this too, I thought of telehealth too, because for a while in COVID, I was moved over to telehealth, obviously, because I couldn't go in anywhere for a session. And I know they've kind of been like multiple thoughts about telehealth. Some people really like it and some don't, and not all therapists will do it. So I know in my experience, I benefit a lot from being in a physical place just because I like having almost like that safe space kind of separate from my home life. But I also have heard from people that they're like, the idea of driving to a therapist's office makes me so nervous, and they like being able to just be on the phone and be on their own couch or, you know, be in their own space and feel comfortable. So I kind of wanted to open up to kind of with telehealth allowing patients to have a little more control too over, do I do it over the phone? Do I do it over Zoom? If you guys had any thoughts about that and kind of changing how that care looks too, kind of outside of a very like almost sterile clinical experience at times.
I know the one thing that comes to mind for me is that like it seems like telehealth is a little bit more compatible with like insurance, and it's like more likely to accept individuals seeking help compared to like going to a physical place and looking for therapy. So I feel like that limits kind of those individuals who are uninsured or can't really afford insurance or don't have insurance. They're really only limited kind of to that telehealth, and they don't have other options to kind of seek care if they want to choose the physical route of going to a place, or if they want to choose to do telehealth. I feel like it's really just telehealth for them because they don't really have many other options.
I do feel like, though, having the autonomy for a person to decide what environment is most comfortable for them aids to a person's ability to seek out treatment and help. If they're able to say, these are the terms I'm going to do it on, I think that makes it more likely that they will trust the process of therapy and mental health care. So if they can set that boundary for themselves of, I don't want to be in a sterile office environment, they have the option to do that. I think that has helped expand how many people are seeking out treatment in that way.
I lost my Zoom there for a second. There it goes. Yeah, for sure. I think it does allow kind of more autonomy for patients, since it can obviously be an uncomfortable situation to be in. I think, hard question to ask, but if you guys, and you can share from like personal experience if you're comfortable, or just like things you've heard, I find it interesting that, you know, when you look at statistics among people 15 to 28, suicide is still the second leading cause of death. But then on the flip side, you see a lot in like social media about access to care is getting better, and we have more phone numbers, and we have more hotlines, and we do have telehealth. And I know for myself, I've struggled with, how do we have like technology and all this that on one side is saying like these barriers are being reduced, yet it's still such a big, you know, crisis and such a big problem. So I didn't know if you guys had any thoughts on that, on if it was an access to care thing, or if you guys thought there were different barriers playing into that.
I think from my own personal experience, as someone who has struggled with that before, I think it's like not knowing where to start. Because like if you're in a crisis, like I didn't know what to do and I didn't know who to call. And I know there's like a ton of different options, and there's like local options and then like the hotline and stuff like that. And sometimes it's just like really daunting to like try and figure out what to do in the moment.
In my experience, I think it's been kind of a one step forward, three steps back thing, because while access has improved in some ways, there have been more, I guess, obstacles that have been presented in recent years. I know social media can be great for promoting treatment and destigmatization of mental health, but there is the pressure that comes with social media and the comparing yourself to other people and listening to what other people have to say about you. can add on stress, as well as in recent years, the COVID pandemic definitely had a large, widespread effect on mental health in the world, basically. So I think that while we did see that expansion of treatment options, sort of some of those contributing factors have gotten worse.
I agree with you both. I think it's like definitely, some good points there. And I agree. And I think also like another thing I think about is like almost you can lead the horse to water, but you can't make it drink. So, if you can give people so many options to do something and they have to do it, so I think like also kind of finding out why they may not be seeking like that care, why they might not be like doing that. It might be because it's daunting. It might be because like their parents think it's they grew up in a household that it wasn't really talked about, or things like that. Like that's kind of like a little bit of like slightly my experience. I just like it was there. I just like was like I don't need it, or I don't think I'm like that bad, or things like that, or I don't really want to go, and I think it's just that person. We need to find out maybe why they don't want to go.
No, for sure. I think that's a great point to bring up too, of like wanting to change things. But yeah, I think that's a good point too, of like finding out the why. And because I think, yeah, if you ever want to make change in anything, if you don't know what's driving somebody to, act the way they are or stay in the way they are, they can't ever. Yeah, I also think the point of it being daunting, yeah, I relate to that a lot, which is kind of why I picked this topic too, because I know for myself, I've called places and it's like, it's almost more work to do it, because it's like you call and they're like, oh, we're not available, or I'm like, I don't want to wait 4 months, like I barely wanted to call now, or it's like you have, oh my, sorry about that, my phone's blowing up, or you have like so many different options and it's like, which one do I do now? And it's, yeah, it can be daunting of like, oh, like you gave me all these options but I don't feel well equipped. I know a lot of places will hand out like sheets and it's just like 12 different numbers to call, and it's like, I know in my case that hasn't been helpful at all, because I'm like 12 different numbers to call, like okay, cool, and I just like shove it in a corner and I don't really do anything with it. So I didn't know if you guys had any thoughts of like if there was like one thing or like a couple, something that like sticks out to you that you wish was different that could just make the experience a little bit easier, since obviously this isn't something we can like change overnight, but just to kind of bridge that gap so it doesn't feel like such a painful process to try to get care.
I relate to like so much to you talking about making that one phone call is like a huge deal that takes so much effort. And then the effort of, again, showing up to your appointment and talking through those huge things, it just feels so, like you said, daunting. And I think for me, I get the point of talking to someone over the phone and making the appointment that way can be beneficial in a lot of ways. But using online booking systems for people, especially people that are coming in from a place of huge anxiety points, and maybe that talking on the phone or talking to a stranger about these mental health problems is a point that causes them more anxiety. Using these booking systems where they can say, okay, here's the date that this person has available, so I'm going to put myself in there without having to talk to anyone about it. And it's just click, click, done, I think is a thing that would have been helpful for me. I mean, obviously, phone calls get made eventually, but I think that having the ability to do so without a phone call might be helpful for a lot of people.
No, yeah, I relate to that a lot, Sarah. I like hate making phone calls. Like my mom knows this about me. She'll call me and be like, have you called yet? And I'm like, no. And it's like so silly because like you put me in like a nursing student role or a babysitter role. Like if I have to call someone, then I will. But when it calls, like I have picked healthcare providers, whether it's for physical health or mental health, that don't require me to so much pressure of like a 15-minute phone call that almost feels like an interview. Yeah, I agree that having that, especially in a world of technology, we're already doing like telehealth and so many things. I think, yeah, that's an easy way to just kind of take some of the pressure off. Any other thoughts?
I don't know if this is like more specific, but sometimes the like emergency lines, it's very like robotic, if it makes sense. Sometimes I just like wish they were like a little more personable, but it's like I understand they get like a lot of calls and stuff like that, but just from my experience, sometimes it can feel very like cold, you know, and that's not like the thing that I need to be hearing in a crisis.
I don't know about y'all. I've been seeing a lot of TikToks about people being put on hold on those crisis lines. So I don't know how necessarily that could be addressed, but I think that, I don't know if it's being talked about as much as it is, or at least that I've seen, that might need some rethinking. I don't know.
I definitely agree with you, Sarah. I've seen a lot of those TikToks too, and I was reading the comments on one, and a girl had said that she called and she was crying, and they told her that we do not help crying, like people crying. Like, we won't talk to you if you're crying. And it's so sad because like that person needs help. Like that person desperately needs help, and yes, you might not be able to understand them in that moment, but you can bring them down, and that's what you're supposed to do. You're supposed to be there to help them, and the hotline is something that has to be turned around, definitely. It's not as helpful as what it seems as it should be, but it is a helpful tool, don't get me wrong. Like, it has helped a lot of people, but improvements need to be made, definitely.
I saw one thing, and I don't know how true it is, because I saw one of them where she was talking about how, like, she was crying on the floor of the bathroom, called one of the emergency numbers, and she was like, they're like, hold on 1 second, and like put her on hold, and someone had said like it's almost like a distraction technique, so you're almost like I'm not saying should be done often at all, because I feel like you toe the line. I mean, it helped, because she was like, I got so mad and like confused and frustrated that I was like, I feel better, and just hung up the phone. Like, and she like didn't do it, and I mean, it helped. I don't know if that's like the actual like thing, or if it just like happened to work that time. But definitely very interesting if it is that technique. But I also think, again, you toe that line between annoying them so much that they're like, fine, I'll just do it then. But I don't know.
That seems like such a risky technique. I can't get behind that.
Yeah, no, that was the exact TikTok that I saw that I was talking about. Some of those comments did say, like, the thing that kept me here was being so mad about it. But there are crises, and some people can't have that foresight of saying, okay, I'm going to be mad about this, but I have to stay here to deal with it. You know, not everyone has that ability.
No, yeah, for sure. I've seen those things too. I've even had like people like close to me like be like, so I called the hotline and they told me like, oh, we don't have time, or there's no beds available. Hung up, and I was like, so I'm coming over to your apartment now, or you're coming here, like what? So yeah, I think it goes into the next point I had, which is kind of a good segue of like, because I know, you know, these or professionals like this are trained in a lot of like crises, but I've heard a lot more stories of, you know, people are like, I'm having a heart attack, and they come and they're like, no, that's not a heart attack. And then there's not necessarily training of how to help someone and best support them in a crisis, because it's kind of like a lot of the time, like Jasmine was saying, it is like crying, and you know, people sometimes are like, oh, someone's in a crisis, they're not like sitting there super calm, like super coherent, they're like crying and like thoughts are racing. So if you guys have any thoughts too about just training of the people who are, you know, working kind of on those like front lines, so to speak, taking those phone calls or responding to calls, and how knowing how to deal with that in an effective way can almost impact care down the line.
Not to like completely out myself, but I was in a state of crisis, and one of my friends had called, I guess, 911 to say like somebody needs to go to her house basically. And the cops show up, and he was just like, "Are you okay?" And I was like, "No." He was like, "Are you gonna hurt yourself?" And I was just like, "No." And he was like, "Okay," and then left. Was kind of how that went. So I think maybe expanding training to any first responder. I know policemen are equipped to handle a lot of different emotional states, but I feel like that has to do more with conflict resolution than it has to do with personal safety of like an individual. So I wonder if maybe different training resources for whatever professional can step in.
No, yeah, I agree with that. I also think, like with that too, it's almost like first impressions can like make a big difference in that point, like what we were talking about with the TikToks. Like some people that like first impression of the anger like worked and it like was great, but then some people, like if that's what they received, they like would never call back again. So then it almost deters them from using services of like, oh, well, I tried to use the service and the person like stepped away from the phone, or like I tried to use the service and they told me nobody was like available. So I've also thought about that a lot too, just how those kind of like the first interaction you have with someone can kind of impact.
And I do think the coldness that some of the first responders have to like, they're clearly checking off a box, which I get. Long shifts, long hours, it's a stressful environment, but that can affect how the situation plays out if they are just clearly checking off, you know, she's fine, she's stable, she's intact, basically. So I think empathy could be a thing. I don't know.
So yeah, those were kind of the main things. Obviously, this is like a very complex thing and not something that can be changed. But I kind of wanted to talk about it because I know in my own life, this has been kind of the topic that hasn't been talked about a lot. And when I was in those moments of, you know, okay, I'm ready to use the resources, I felt like I had a lot of people who knew the resources to give me, but didn't know how to navigate helping me through them. So it felt very like isolating and alone to be like, oh, so like once I have the sheet of paper, what do I do with this now? Like, how do I use this now? So just kind of wanted to open up the conversation that way. People know if you're having a hard time working through the system, like you're not alone. It's worth it. Like I'm with a great therapist now. It took a while, but it's worth it. You know, it can be hard to keep trying, but it does eventually fall into place. And there's kind of people out there that can help you navigate the system. So yeah, if anybody has any final thoughts, they can share them. If not, I think that's it for this episode.